Right.
So that was the one that I presented last week, but Renee has a different link. So.
But I've used that link to get on today because I'm clearly here with you today. Yeah. But the chat is just an ongoing scrolling chat of of other things.
Right. Okay.
Yeah, I don't know why that is. So, you know.
But I think isn't the meeting chat different to that kind of just generic chat?
Yes. It is.
Hello there. Yes. Yeah. Meeting chat's fine.
Thank you. I'll get that comments and I'll put them into the new chat. I see the new chat. Thanks, everyone. All right, welcome everyone. We'll just wait a few more minutes while other guests dial in, but for everyone that's joined us so far, thanks very much for joining us for Amanda Rush's final PhD seminar with the New South Wales Health Statewide Biobank. So we'll just wait a few more minutes and then we'll get started. Good morning, everyone. Just adding that we're just waiting for a few more people to join, but you're here at Amanda Rush's final PhD seminar within the New South Wales Health Statewide Biobank. So thanks very much for joining us. We'll be with you in a couple of minutes. Yeah, someone's commented that we need some on-hold music. I'm not sure what kind of we need a biobanking themed on-hold music.
We have a lot of talent in the biobank, Jenny, so we should probably tap into some of it.
Yes, Adam and I will get working on that as soon as we possibly can.
Yeah.
It's going to be very bass guitar heavy.
Yeah.
Sounds good. All right, look, I think in the interest of time, we will probably start recognising that people are going to be joining us progressively. Thank you, everyone, for joining us for today's statewide biobank seminar, which is Amanda Rush presenting her PhD results. So my name's Jennifer Byrne. I'm Director of Biobanking, but today I'm here really as Amanda's PhD supervisor and representing her other supervisors who are Rod Dean, Andrew Sells, Peter Watson and Daniel Catchbull. So Amanda Look, I think it's customary at the beginning of PhD seminars to give a brief bio to the speaker and outline the student's career, and certainly Amanda has a really very impressive career to date. So she actually graduated with a Bachelor of Science in Microbiology and Immunology from the University of New South Wales, and she subsequently obtained a Master of Public Health from the University of Queensland. And Amanda commenced work in Queensland as a clinical research associate and as a research officer before moving to New South Wales, where she's held a number of roles. She joined the Children's Hospital at Westmead as a clinical research associate in biobanking in 2010. And she worked for the Children's Hospital at Westmead Tumor Bank during that time, after which she actually joined me as a senior research officer to support a number of statewide biobanking projects that were funded by the Cancer Institute New South Wales through the Kids Cancer Alliance Translational Cancer Research Centre. And then late in 2016, I mentioned a project that I had thought about that seemed like an ideal PhD project, and I saw this particular look in Amanda's eye, which I recognise very well. And so early in 2017, Amanda applied for and was awarded a New South Wales Health PhD scholarship to apply health economics principles to the study of biobanking. So Amanda has been enrolled through the University of Sydney, and she's coming towards the end of her PhD studies. Amanda really has a formidable background in biobanking. She has done many things beyond those that I've mentioned through her work history. She's the current biobanking representative on the Children's Hospital at Westmead Network Human Research Ethics Committee. Amanda has worked as a senior policy officer with the OHMR. She has been an associate editor for the 4th edition of the ISBA Best Practices in Biobanking, and she also participated in the Australian review of the ISO standard for biotechnology and biobanking. So at times, I have really wondered what I have had to teach Amanda, and certainly I have learned as much from Amanda as I think I have imparted towards her. So it's a great pleasure to introduce Amanda to present the results of her PhD. And just because I am Amanda's supervisor, I'm not going to ask her any questions. So I really would appreciate everyone on the call thinking about questions to ask Amanda after her talk. Amanda, we look forward to hearing of your PhD results.
Well, thanks very much, Jenny, and thanks to the New South Wales Health Statewide Biobank for having me here today. When I started my PhD in 2017, I had no idea that I would be sitting here using Zoom to present my final results and writing up my thesis during a pandemic, but here we are. So on the front page here, you'll see that I've pasted a cartoon of a biobank using the pillars of the bank as different aspects of biobanking. And what I'll be focusing in on today is that bright red pillar, the business strategy of biobanking. Okay, so it's generally accepted that human tissue banks are important facilitators of health and medical research. I hope we can all agree on that point. So despite that, there's many academic biobanks that have faced sustainability challenges. And we've witnessed this in our own 5 years of research where 23% of New South Wales cancer biobanks have actually closed to accrual over the last 5 years. And on an international stage, a number of large-scale biobanks have actually closed down, including the Singapore Biobank, BBMRI Sweden, and Decode Genetics in Iceland. So we defined biobank sustainability as the maintenance of biobank operations and value over the intended lifespan of the biobank. This lack of sustainability leaves biobanks vulnerable to collecting fewer samples of possibly reduced quality, maybe offering fewer biobanking services, and ultimately and unfortunately closure. So how do we place a value on biobanking where value has, we've put a broad definition here, a worth, a utility, or an importance? So firstly, any measure of value should reflect our broad goal of supporting health and medical research. And we propose that a lack of information on exactly what biobank value is confers a threat to biobank sustainability. So there's many different methods and perspectives for measuring value. So I've listed some here. The list is not exhaustive though. Things like the size of the cohort, extent of data annotation, rarity of samples, and that was written about by Lockmuller in 2009, whether biospecimens are fit for purpose, use of quality frameworks such as the ISO 20387, a hot topic, extent of biospecimen or data utilisation, written about by Bledsoe and many others, importance of sample-supported scientific discoveries, and also biobank outputs, which is where we'll turn our focus now. So the value of a biobank can also differ according to stakeholders. So I've listed a few different biobank stakeholders here: society, clinicians, consumers and participants, organisations, policymakers, funders and researchers. So with my talk today, it will be divided into 4 parts. The first part will be an outputs focus for biobanking, and this is based on a commentary paper that we've recently produced. Part 2 will be a comprehensive analysis of the costs and publication outputs of an academic biobank cohort. Part 3, what do researchers want from biobanks? And I'll summarise in part 4 what I think are the factors for successful biobanking. So let's get into it. Part 1, an outputs focus for biobanking. And this will focus on the biobank itself. So to define what we mean by biobank outputs, we put together what's termed a biobanking program theory. And this is comprised of inputs, activities, outputs, and outcomes. So if we centre in on the output column, we can see that outputs refer to the number of research studies supported, number and quality of peer-reviewed publications, number of clinical trials supported, extent of staff and student training, provision of specialist tissue services, and support of precision medicine. So there's currently an underrepresentation of biobank outputs in relevant publications. So this is demonstrated by a Scopus search of biobank publications from 2015 to 2018, where we compiled a list of terms that we thought represented biobank outputs, and we compared those to single biobanking terms down in the left-hand corner, output, processing, and storage. And we can see that when biobank output as a whole list of terms was compared with biobanking processing, biobank consent, and biobanking storage as separate single terms, although there were 10, I think, terms in the biobanking outputs column, then the other single terms comprised over half as many publications. So currently there's few real incentives for end users or researchers to acknowledge biobanks in their publications. And this issue is compounded by the fact that years can pass between biospecimen provision and publication. And this can reduce the likelihood of biobanks actually being informed of publications that highlight the use of their biospecimens. And this in turn means that biobanks must proactively search for supported publications. So you might have heard of the Bioresource Research Impact Factor, the BRIF. This was described by Mobile in 2013, I think was the latest paper, although there were a few before that. However, it doesn't cover all output types, and it also, unfortunately, hasn't had a wide uptake. A lack of outputs focus can leave biobanks unable to track fluctuations in their activity, unable to calculate realistic resource costs that are associated with outputs, and also unable to conduct economic analyses and build business cases. So as I mentioned, there's more on the idea of an outputs focus in our recently released publication, and that was in Value and Health, Improving Academic Biobank Value and Sustainability Through an Outputs Focus. So I'll move now to part 2, which is a comprehensive analysis of the costs and publication outputs of an academic biobank cohort. And this will also focus on the biobank itself. So in recent times, biobanks have developed business plans in response to widespread sustainability challenges that I've mentioned earlier. And historically, biobanks have tended to demonstrate their value through citing metrics such as number of biospecimens stored, number of participant consents, and these metrics provide a sort of operational value. They're most readily available and they don't rely on any end user input. Aspects of a business plan can demonstrate a type of biobank value based on appraisal of costs and outputs. And we performed a deep analysis of costs and outputs, which can be used for intra and inter biobank comparisons. So our aim was to conduct a small but in-depth study to determine and evaluate annual operational costs, that is monetary plus in-kind costs, and also focusing in on one output, publications of a group of N equals 12 cancer biobanks. So after developing interview questions that were based on our program theory, we sent an expression of interest out to 17 biobanks that we had studied previously and that were operational in 2015. And 12 of these agreed to participate. And those biobanks had a range of tissue types stored and also collection and staffing sizes. We undertook face-to-face interviews, and these were centred around 3 different areas. Firstly, monetary costs for the 2017-18 Australian financial year, such as staffing, asset depreciation, consumables, software depreciation, and any other costs that the biobank incurred during that period. We then turned our attention to in-kind costs for the same time period, looking at any pathology support in the form of collecting, processing and characterising tissue, any committee activities such as access committees, and also the floor and laboratory space that the biobank occupied. And we did that so that we could calculate accurate representative costs for the in-kind portion of the biobank's operational costs. And finally, we asked for a list of publications that the biobank had supported for the years 2015 to 2018. And you might have noticed that that period is obviously 4 times as long as our costing period. And we did this to allow publications, and especially their metrics such as citations, to accrue over that 4-year period. This meant that the costs incurred by the biobank weren't directly responsible for those publications. However, they could provide valuable data on the likely supported outputs of a particular biobank in future years. We then performed further data collection and calculations based around the in-kind salary costs, laboratory space costs, and we also collected a whole lot of publication metrics around the 144 publications that our cohort of biobanks supported over that 4-year time period. And these included journal impact factor scores, citation numbers, altmetric scores, which is a measure of the impact of grey literature such as Twitter and news feeds and blogs, and also the field-weighted citation index for each biobank, which is an index whereby publication citations are applied to the global average citation in the field. And data collation occurred in Microsoft Excel, and our calculations and statistical analyses were performed in SPSS. So if we first look at the costs of the entire 12 biobank cohort, we can see in black that the total annual costs range from 950,000 down to about 150,000, and there was a median total annual cost for our cohort of just over $408,000. Staff costs are in the pale grey with a median of 300,000, and in the dark grey are in-kind costs with a median of 57,000 for the 2017-18 financial year. And if we now look at the proportion of staffing costs over that time period, we can see that they range from, I think that's 86% down to 19%. So they formed the majority of costs for 11 out of 12 of our biobanks. And finally, the proportion of in-kind costs range from 5% in the pale grey on the left through to just under 50%. So turning now to publication outputs, the number of publications in the black columns ranged from 43 down to 5. And sorry, the axis on the left-hand side of the y-axis denotes that. And in great news for biobanking in general, on the right side of the y-axis, we have the field-weighted citation impact, that score of how many citations the biobank has supported as opposed to a global average for that field, which is 1, the global average, and we can see that there in the orange line, the orange horizontal line. And pleasingly, 9 out of 10 of our biobanks scored above the global average field-weighted citation impact. And there was a median field-weighted citation impact of 2.63, meaning that there was 2.63 times more citations supported by those biobanks than the global average. We'll turn now to classify our cohort of biobanks by an by a classification system that was put forward by Watson and Barnes in 2011, so almost 10 years ago, where they proposed that poly-user biobanks supported multiple research studies, were generally of a larger size, were generally represented more formal biobank operations, and we've termed them open access biobanks because they're open to anybody in the world. Whereas oligo and mono-user biobanks supported either a single research study or were related to research groups, were generally of a small to moderate size, and we've termed them restricted access because they're restricted to either one researcher or a small number of researchers. So in previous research, before I started my PhD, we had found that open access biobanks were more likely to undertake QC measures, to utilise SOPs, to be more aware of biobanking best practices, to employ more staff, engage in staff training, and send staff to conferences. So all of those things pointed cumulatively to the fact that we thought that features of open access biobanks enhance their ability to support research compared with restricted access biobanks. So looking now at our results table where we had divided our cohort into open access biobanks and restricted access biobanks of n equals 6 each. I'll just orient you to the table. So on the left-hand dark orange column, we have comparators such as the number of publications supported or the quantity of publications, estimated cost per publication, and a range of publication metrics, including journal impact factor, number of citations at a particular time point, altmetric score, again at that same time point, and our friend, the field-weighted citation impact. And we can see that statistically, there was no difference in the number of publications supported by open access versus restricted access biobanks. Furthermore, there was no statistical difference between any of the publication quality metrics that we looked at. These p-values were all above 0.05. Interestingly, we did find that the proportion of publications with formal biobank acknowledgements in the methods or acknowledgement section was actually statistically much higher in the open access biobank cohort. This was kind of an expected finding though, which we had attributed to the fact that by definition, open access biobanks are more likely to utilise MTAs for external researchers that stipulate acknowledgement of the providing biobank. So we then turned to divide our biobank cohort into two groups based on their total costs. So based on the in-kind and the monetary costs of the biobank. So the top 6 operational costs were called high-cost biobanks, and the bottom 6 were called low-cost biobanks. And we actually compared those 2 costs just to check that they were significantly different, which they were according to a Mann-Whitney test. And we hypothesized that resources available to a biobank determine the quality and or quantity of supported research output. So with a similar results table, we can see that the quantity of publications supported by high cost and low cost biobanks were actually similar, greater than 0.05. However, when we look at the quality of the publications, we can see that the journal impact factor and the altmetric score were significantly higher in the high cost biobanks. And additionally, the proportion of supported publications with at least one biobank staff member as an author were higher, much higher in the high cost biobank cohort. So in summary for part 2, we can say that open and restricted access biobanks were unexpectedly similar in the quality and quantity of their publication outputs, however, were expectedly more likely to be acknowledged in an open access biobank setting. And when high and low cost biobanks were compared, there were comparable numbers of publications as well as numbers of citations. However, high cost biobanks had a higher proportion of high journal impact factors and altmetric scores. So to conclude, this is the first analysis that we're aware of looking at biobank costs and publication outputs. We performed this in a small cohort of biobanks for practical reasons. We've been studying these biobanks for years. It's a type of study that requires strong relationship building with biobanks, and it also requires time for publication metrics to accrue. Very pleasingly, the field-weighted citation impact of biobank supported publications for our cohort are above the global average with a median of 2.63. We found that access policy is not a predictor of publication quality or quantity of output. However, higher cost biobanks may support publications with greater prestige in the form of higher journal impact factors and higher altmetric scores. So we'll now turn to part 3. What do researchers want from biobanks? And this was the results of an online survey, and the biobank stakeholder that we'll be focusing on here is the researcher themselves. So in this section, I've investigated the needs and opinions of biospecimen researchers. So as we all know, for companies, market research has been a long-standing approach to inform business decisions. And in the case of biobanking, biospecimen researchers act in that role of a business client. So we can use that to obtain insight into the activities and opinions of our customers. Biobanks not meeting the needs of researchers are unlikely to be sustainable. And also this type of study is probably more likely to be of greater benefit to open access biobanks, just because by definition, the researchers are external to the biobank. So our aim was to determine and evaluate the needs and opinions of Australian biospecimen researchers, and we had 137 responses. So there've been 2 previous published investigations into biospecimen researcher needs, and these were both for specific reasons. Firstly, almost 10 years ago, Massett conducted a USA-wide survey of 727 American researchers who were cancer biospecimen researchers with a view to developing a national standardised human cancer biobank, the CA Hub, which is now up and running, as far as I know. And most recently, just a few months ago, actually, Emma Lawrence in the UK published a UK-wide survey of biospecimen researchers with a view to informing the development of the UK tissue directory. And this had 7 questions and was responded to by 198 researchers. So we started by developing our online content. And this comprised sections on the localities of biobanks accessed, methods of sourcing biospecimens, opinions on application processes, data availability, access fees, progress reporting requirements, and return of research results to the biobank. This was a comprehensive survey. It had 23 multiple choice or checkbox questions. There were 4 Likert scale questions surrounding satisfaction with particular aspects of biobanking, and 8 of the questions had provision for further comments. We distributed this by 4 of the most populous states in Australia, New South Wales, Victoria, WA, and South Australia, and had good responses from all of those, with a total of 137 responses, as I said. Data collation and also analysing the written responses occurred in Microsoft Excel, with calculations and analyses again occurring in IBM's SPSS. So in terms of research roles, just to set the scene, there were 44 basic laboratory scientists, 37 self-professed translational researchers, 23 clinical researchers, and 10 researchers who thought of themselves as not belonging to one of those 3 groups. These included population researchers and some industry representatives. The majority of the respondents fell within the early career stage, so up to 7 years postdoc or equivalent, or the mid-career stage, so between 7 and 15 years postdoc or equivalent. And when we asked them a question around, this was a Likert scale looking at overall biobank application processes, we can see that the median response was 8 out of 10. And our interquartile range, even the bottom of that, was still at 6 out of 10. So we can say that biobank researchers were very satisfied overall, which is pleasing. So in terms of fit for purpose of samples and data, again, the same results. So a median of 8 in terms of satisfaction for fit for purpose of samples and data. We'll turn now to the not so good news. So the suggested improvements, where the top improvement that researchers were after was availability of biospecimen formats, types, and numbers. And so investigating this further, we can see 64% of researchers had actually limited the scope of their research due to difficulty in obtaining biospecimens, with basic and translational researchers more likely than their clinical researcher counterparts to limit the scope of their research due to sample unavailability. And researchers gave comments simply as samples were limited in numbers, numbers of specimens available is a major limitation to our research, and we research rare cancer types, there's infrequent and low patient numbers. We also asked researchers whether, for the most recent time that they had used biospecimens, had they created their own collection, obtained from an existing biobank, or contracted another biobank to collect for them. And 61 out of 99 of the respondents had actually created their own biobank. So beyond a lack of availability of some samples and data, we actually thought that this was incentivized by low startup costs in terms of, baseline biobanking. Really just a -80-degree freezer and a Microsoft Excel spreadsheet is all that's required. But they were probably also discouraged by high costs for accessing biospecimens, lengthy and also lengthy and cumbersome application and reporting processes. So we'll see more evidence of this type of behaviour as I continue my presentation. And although we'd hypothesised that seniority in career level would influence whether or not researchers created their own biobank, this wasn't the case. If we turn now to focus on an influence of why biospecimen researchers selected a particular biobank, the third top influence was actually proximity. So most researchers accessed either a local or an intrastate Biobank, 78%, and this actually agrees with Emma Lawrence's paper where the second top response for selecting samples was locality. And researchers gave comments such as that samples were often collected or often obtained through personal connections. It's optimal to seek out biobank staff who are well connected with clinical pathology and surgical colleagues to identify the most appropriate donors and secure high quality fit for purpose tissue samples. And the need for researchers just to make personal linkages with surgeons and others who collect the tissue. This is the most efficient way. So accessing local biobanks suggests that researchers plan research or experiments based on local resources rather than biobanks approaching them to match their research interests with available biospecimens. And researchers value their local biobank for that kind of soft intelligence factor, knowing who to turn to ask about samples. We'll focus now on another suggested improvement in biobanking, the cost of obtaining biospecimens, which was also the top influence for researchers selecting a particular biobank for their needs. So researchers recognised that biobanks are on a tight budget, like themselves, and therefore it was important to strike a balance between offsetting biobank costs and discouraging applicants to apply to existing biobanks. So they gave comments such as fees impact early career researchers the most, and they often have the smallest grants. Perhaps there could be fees based on ability to pay. And biobanks need to be viable, and they're a research input just like any other. Therefore, they need to be included in grants, and there should be a flexibility in charging depending on circumstances. And when we gave researchers options on access fee models, and they could select more than one, the highest response was for higher fees for commercial researchers, acknowledging here that most of our respondents were not commercial researchers. Researchers should pay fixed fees from their grants, and thirdly, researchers should pay transport costs only. And we'll have a look now at annotated data, which was the third top response for suggested improvements. And we can see here that our satisfaction score is starting to drop a bit, with still a median of 7. However, the bottom of our interquartile range is really hovering on that stage between satisfied and dissatisfied. And this is backed up by evidence that the majority of researchers limited the scope of their research due to difficulty obtaining data. And they had quite strong feelings on this. Researchers would be able to gain a lot more if the clinical data is readily obtainable. Research progress is being profoundly adversely affected by the degree of difficulty associated with getting data about specimens, and there needs to be better linkage with patient data. So this suggests a strong need to improve data accessibility and interoperability. And when we asked researchers exactly what type of data they were referring to, they said we want more long-term follow-up data, more clinical data, and to a lesser extent, more linked government data, for example, hospital admissions or MBS, PBS data. So when we asked researchers about returning research results back to the biobank for use by or for sharing by subsequent researchers, it was a bit of a mixed bag. So in terms of all research data should be returned, 26% thought this and said comments such as this will present duplication and make better use of limited resources and assist with collaborations. Some researchers put caveats on this, but with a provision to apply and make a case for opt-out, and only if it helps describe the specimens better, otherwise no. There was a group who thought that metadata only should be returned. Data is only a value add if it's reliable, and if this can't be achieved, then a description would be a better alternative. It would then be up to the researcher wishing to use the data to ensure the original data is reliable. And finally, a group of around a third who thought that no data should be returned because the result could be unreliable, or unpublished data will be too difficult for other researchers to interpret. And finally, we asked researchers what their thoughts were on biobank efficiency compared with other research infrastructure, such as animal houses or microscopy units. We had 42% thinking that biobanking was more efficient than other research infrastructure, 20% about the same, and 39% less efficient than other research infrastructure. And they had some really insightful comments to finish up. We have the potential to learn so much from properly curated and researched biobanking specimens. We need biobank specialists, not researchers moonlighting as biobankers. Until biobanks are seen to be crucial research resources and funded accordingly, our research use of biospecimens will be suboptimal. And finally, biobanks need to be research focused, not focused just on their own needs and their bottom line. If they continue with their current approach, they will fade into irrelevance. So to conclude this section, biospecimen researchers were satisfied with biobank application processes and fit for purpose of samples and data. Most researchers reported creating new collections when they needed biospecimens. Researchers preferred to access local biobanks. The cost of accessing biospecimens influenced the choice of their biobank, and there's a strong need for greater data accessibility and interoperability. And we'll move now to section 4, factors for successful biobanking. And we'll turn now to focus on external stakeholders, funders, and policymakers. So firstly, what are the benefits of the biobank output focus that we've described? Well, it has the ability to influence both biobank operations and strategy. So things like business planning, so particularly informed redirection of resourcing, benchmark setting for biobanks with the aim of higher quality and quantity of research output, developing and updating cost recovery plans in light of researchers' capacity to pay, and looking at targeted improvements to data availability, focusing on long-term follow-up data, clinical data, and linked government data. We acknowledge that there's risks to an output focus. This could be quite resource intensive and possibly even more so for small biobanks. There could be a misinterpretation of value by funders and policymakers. So what I mean by here is, for example, a rare disease biobank might support fewer publications. So it would be really important for biobanks to reflect on their unique contributions to the health and medical research landscape. And like any metric approach, it might incite a sort of metric gaming. I'm aware of Goodhart's law, where once a measure becomes a target, it's no longer a good measure, but it could influence biobanks to focus on short-term outputs and rapid publication turnarounds. And it may also bring about an evolution of alternate biobank models, which may benefit some biobanks and yet disadvantage others. To assist biobanks in focusing more on outputs, I've put together an outputs template, an outputs reporting template. So on the left-hand column, I've listed the types of outputs that could be recorded: publications, clinical trials supported, staff and student training, precision medicine supported, specialist tissue services, and any other outputs. And then across the top, we've just got the date, the details of provision of biospecimens and data, the details, if there's any metrics associated with those outputs, and whether the biobank was acknowledged for their contribution. Turning now to the relevance for funders and policymakers, studies that investigate costs and outputs provide accountability, first of all, for decision-making for stakeholders. They could consider rewarding biobanks with high impact research, consider rewarding outputs rather than focusing on an open access model, recognise the value that researchers place on local capacity, and also use their position to lobby for clinical and government data linkage. So our costing study was performed in a small cohort, and we experienced some expected results, or kind of positive controls, such as the fact that open access biobanks with material transfer agreements were more likely to be acknowledged in publications. And this provided further confirmation for our unexpected results, such as the fact that there was no difference in the quality or quantity of publication outputs between open and restricted access biobanks. We could, in the future, test our open and restricted access and high and low cost frameworks in a larger cohort, but we would have to probably develop some kind of proxy for the variables, as this was a pretty large workload, even for 12 biobanks. For example, we could use staff full-time equivalents as a proxy for operational costs, as it comprises the majority of costs and the information's pretty easy to obtain. Results could also be tested across other biobank types, such as population biobanks or pathogen biobanks. And finally, biobank planning just needs to focus on customers to maximise their research support. I will finish up here by acknowledging my fantastic supervisory team headed by Professor Jennifer Byrne, but also including great input from Associate Professor Dan Catchpool, Dr. Rod Ling, Professor Andrew Searles, and Professor Peter Watson in Canada. Although he's in Canada, he's been out here to see me a few times, and well, not just to see me, but also then the Office for Health and Medical Research, who were responsible for my PhD stipend, along with the University of Sydney, Sydney Children's Hospitals Network, and the New South Wales Health Statewide Biobank for hosting me here to write up my PhD. A particular thank you to the New South Wales Cancer Biobanks, who assisted me with the costs and output studies. And also the state survey champions, Mr. Tom Gilbert, Dr. Wayne Ng, and Georgette Raish-Miller in South Australia, and all of the biospecimen researchers that contributed to my survey. And I'll finish there. Thank you.
Thank you, Amanda. That was amazing. Now we have some time for questions. We've got about 15 minutes, so people are very welcome. Ah, yes, I can see Associate Professor Getty is raising his hand. Craig, please.
We're all starting to learn how to use Zoom now, or Teams, or so forth. Amanda, that's fantastic work. Congratulations. It is truly a PhD's effort. So well done. One question I had, there's sort of two sides to the same question. Sustainability of infrastructure and research. Are biobanks special? Are they particularly vulnerable to these kinds of questions, or are they? This is kind of typical for research activity overall. I mean, we're seeing research activity being pounded by all sorts of societal factors. Are biobanks under more threat or less threat? And I guess the corollary to that is, the cost per publication, which you estimated as around $100,000 of investment in biobanking per publication. How does that match to other research infrastructures like histology or microscopy or flow cytometry?
Well, I suppose I should preface my answer with some kind of bias, because I presented a presentation earlier in the year called Why I Love Biobanking. So I think that biobanks are special. I think delving deeper into that, probably the reason for its specialty is that it supports such a broad range of research. I don't know a lot about microscopy or animal houses, but my feeling is that it probably supports a lesser proportion of overall health and medical research than our biobanking friends, just because everything from population, genetic epidemiology through to real clinical research, clinical trials can all be supported through biobanks. So I think that they are special. In terms of their vulnerability towards a lack of sustainability, look, I know that a number of actions have been taken over the years to lobby the government for more secure funding, and up until this point they've been turned down. So at the moment I think we are in more of a vulnerable place than say some other types of research infrastructure, but hopefully there's better things on the horizon for biobanking. In terms of a cost per publication, $100,000, I suppose it sounds like a lot, but I think we need to view a publication as the beginning of a great journey that ends with a change in patient outcomes. And if you, and I'm sure you know, the costs of a new drug getting to market or a clinical trial getting up, those costs are, they're not $100,000. We can add a lot of zeros to that. So I think that it probably just appears that way in the beginning, but publications are that seed that'll hopefully grow into a lovely oak.
It will be interesting to compare. So when we compare diverse health interventions, we use a measure called a quality of life year. So it'd be fascinating to know what a quality adjusted research output would look like across those different kinds of infrastructure spends. That could be quite an interesting exercise. But you finished your PhD now, so.
Yeah, it's interesting that you say that. I recall conversations that we had before my my project was actually hammered down, and we were thinking of a comparison with other research infrastructure. So maybe we'll leave that work for someone else though.
Maybe we will. Can I ask one last follow-up question? You said surveys out to 17 biobanks for your major project, of which 12 responded.
Yes.
How many of the people who responded, how many of the biobanks who responded are still in existence versus the 5 that didn't respond?
All of them.
Right.
Yes.
And the 5 that didn't respond, are they still in existence as well?
They didn't not respond. They didn't have the resource. Probably, the broad answer is they didn't have the resources to be able to participate. I'm forever grateful to the biobanks who did participate, but it did take some pulling together, a collating of our data, and I suppose that really spurred us on as well to say, we do need these reporting templates to improve biobanks' ability to be able to put their finger on particular metrics that could inform their business cases.
Yeah, awesome. Look, thank you again. Wonderful work.
Thanks so much.
Thank you, Craig. Does anyone else have a question for Amanda? See, I do, but I can't ask them.
Yeah, I tried to raise my hand, but it says it's raised, but obviously not clicking through to you. Great presentation, Amanda. Very interesting.
Thanks, Jane.
I just wanted to ask if during the course of this, have you looked at the outputs of commercial biobanks as comparators? And is it worth doing that and say, oh, we're all wasting our time? Should we just let the market determine what's going to go forward? I know there aren't many, if any, commercial biobanks in Australia at the moment, but globally there are. And I just wondered what their outputs are and how they compare with the academics.
I haven't looked into that, mainly because I don't think that they would give us. I don't think that they would give us the answers.
There may be other ways of getting it.
Yeah, but look, it's an excellent idea, and if anyone's going to be able to get rid of the fat in the system and produce outputs, it will be the commercial biobank. And if they're not financially viable from a business perspective, they would just close it. So yeah, I think it's an excellent idea. We need to tap into their secrets.
Yeah, it'd be interesting to know what their publication output is like.
Yeah, well, I think maybe
they're probably not acknowledged in a lot of publications because their agreements are just to supply samples. They're straight supply chain, essentially.
Yeah, exactly. And in fact, if they don't place value on publication outputs, then it's possible that I guess they're not going to be striving for a high journal impact factor, or they might even not even strive to write up things that an academic biobank would support and see as important.
Yeah, I just think it'd be interesting, to have the big picture. Yeah, great, thank you.
Oh, thanks, Jane. I can see we've got questions from Anusha and Usha, so we might go with Anusha first. Thanks, Anusha.
Thanks, Jenny. Thanks, Amanda. That was really great, and congratulations on finishing up.
Oh, thanks, Anusha. It could be a bit early. I haven't written anything yet.
But 95% of the way there. Can I be unscientific and ask you to speculate? You mentioned that a lot of the high-cost biobanks resulted in higher quality publications.
Yes.
Why do you think that was? Or do you have any feeling for that?
Great question. Great
question.
Sorry. Let's speculate.
Yes.
Look, I think there's probably a whole lot of small cumulative reasons. Data given from the researcher survey that I didn't put into my presentation intimated that researchers aren't as worried about sample quality. And yet I think if, this big issue of reproducibility in results, reproducibility is probably born from a higher cost biobank that focuses on high quality biospecimens, a quality framework, more staff, all of those types of things probably then add up to the biospecimens producing results that are eligible in a higher journal impact factor journal. In terms of the alt metrics, look, I think there's a bit of a question mark over that because it is that impact of grey literature. So you don't know, breaking down with the alt metrics, whether it's come from researchers and their friends tweeting about things, or I think it has to be pretty big before it gets into a news feed or something like that. So I think it's more likely that the journal impact factor is indirectly based on a higher quality and higher cost biobank.
Yeah,
I don't know. I don't know if
it's interesting, isn't it?
Yeah. Like, did anything kind of spring to your mind, or?
No, well, that's what I was thinking. It was more the reproducibility of the samples, or that somebody else works on that same cohort maybe, and is able to build on it if they've got that reproducibility. But yeah, that was just one of those interesting things.
Yeah. No, but thanks for bringing that up. I think that's a really good point that will need to be included in my paper, and I probably need to sit down and navel gaze a bit more about it.
Yeah, and I think it's interesting for some of us who are writing business cases at the moment.
Yes.
Yeah. Thanks for that.
Thank you. Usha, I think you had a question.
Oh, I had a question, but that was the same as what Anusha just talked about. I thought not only our names similar, we seem to think similarly. Great work, Amanda. That was a lovely presentation and very, lots of useful information in there. Just following up on the previous thread about the higher cost biobanks having publications in higher impact factor journals, I was also thinking it might have to do with greater sample size being available.
Yes.
Which would give stronger basis to all the statistical power to the statistical findings. So that could be another issue, point as well. So.
Yep, great thought. Thank you.
I think we've got a question from Sarah Furlong. I can read it out.
Can you hear me now?
Yes.
Yes, I
perfect.
can.
Okay, great. Really interesting talk, Amanda. That was amazing. I know I, for one, am definitely going to assess the outputs of our biobank. So I'm from the Neurodegenerative Disease Biobank at Macquarie. But in addition to that, would you recommend that biobanks carry out surveys of their users to identify any changes that might increase the uptake of researchers using the samples and data?
Yeah, look, Jenny and I were continued to be blown away by the fact that, you know, there's only 2 published studies, one of whom has just come out this year and beat me to the punch. But I'm surprised that there's not more work on this, considering that, you know, as I said, biospecimen researchers are the biobank client. So in terms of whether that needs to occur at an individual biobank level, the only reason not to would be around survey fatigue, but otherwise, yeah, I think it's a no-brainer.
Yeah, absolutely. And in addition to that, with some of the templates that you posted there, are you making those public, or will that happen when you publish your paper?
It'll probably go into my paper, but look, the presentation's been given publicly, so you know, if you didn't. Yeah, I think actually the recording will be available, but also, yeah, feel free to email me and I can email it through.
Oh, lovely. Thanks very much. Yeah, we'll keep an eye out for the publication. Right, best of luck with it.
Thank you.
Well, look, I think we've probably coming fairly close to the end, so it might be a good time to wrap up discussion. Thank you very much, Amanda, for a really outstanding talk. Thanks so much to so many people who've dialed in today. It's just, I think it's great to have the opportunity to discuss biobanking from an evidence point of view, and we can only improve our capacity to support research if we have a better understanding of what biobanks actually produce and also what researchers want. So thanks again, Amanda. Thanks to everyone for joining, and all the best. We'll see you. I think our next talk is, I think it's next week, and we have Karen Bletcher joining us from 45 and Up study. So we look forward to that. And otherwise, thanks again for joining us today.